Essential Task 9.5, we are going to discuss the major diagnostic category of somatic symptom and related disorders. There are only going to be really two disorders, though the name of the category can sometimes be referred to as a disorder. So there are only three boxes here. This might be a categorization that you're not as familiar with. The last time I asked you to watch one of these at home, we talked about eating disorders, which is something that you may have heard of in wellness class. The somatic symptom disorders are unique, and we'll talk about them today. I recommend horizontal, though I think you could easily do this vertically, as you see here. I'll return, though, to the task text if you haven't already copied it down, allow you to pause the video before proceeding into the concept map. The term somatic symptom can sometimes be called somatoform. So regardless of how it's referred, as long as you see that word soma, S-O-M-A, which by definition means related to the body, you know what we're referring to. Somatic symptom disorders are disorders in which the patient experiences some type of physical problem or believes they're experiencing some type of physical problem without an identifiable cause. In theory, if you were paralyzed, there would be some logical explanation. If you experienced some type of immobility, if you experienced some type of really severe physical problem, we typically can figure out why. However, there are some unique circumstances that we're going to cite today, one disorder in particular, where the patients have no identifiable cause. Tests come back completely clean. There is nothing physically wrong with the patient. As a mnemonic, just so that you're aware, the word soma means related to the body. So if you see that word somatic, you can connect that as a clear indicator that the symptoms of the disorder are related to the body, which is going to be the case with the two disorders we talk about. They are both related to the body disorders. The first of which is the ever fascinating conversion disorder. This one is incredibly rare, but it is a very fascinating disorder where the patient has very genuine physical symptoms. I am talking about an inability to walk, paralysis of one part of their body relative to another. I mean, we're talking about incredibly genuine and real symptoms. The person is absolutely positively not faking it, nor would they want to. But all of the tests come back clean. Nothing comes back in the testing that indicates why these symptoms are present. The belief is potentially that the symptoms are more psychological as opposed to physiological. Physiological, the word listed in the definition, means related to your body. So things like your heart rate, things like blood tests, things like your cardiovascular system, those are all physiological. Psychological are more cognitive-based reasons. So potentially, and this is only a theory related to conversion disorder because it is rare, the belief is that maybe something stressful in your life produces this psychological response that ultimately results in sort of shutting down, in the case of the clip that you'll watch on the right side here, movement. I would like you to watch the entirety of this clip on the right. It is really fascinating. It's a young girl who suffered a sports injury, and all of the tests came back clean, like I alluded to. There's really no physical reason why she experienced her immobility, but very clearly she was unable to walk as an aftermath of her injury. And the explanation that they gave is conversion disorder, that there is nothing physical, nothing physiological, nothing that you can see on a test, nothing on a brain scan, nothing on a MRI of her knees, nothing that would indicate why she was suffering these symptoms. The belief is that it was psychological. It was almost a body defense mechanism in response to the trauma of the sports injury that shut down, in this case, her movement. And in most cases, the movement can come back. The patient can be returned back to just normalcy over time. But in the moment, it can be very scary to be told there's nothing physically wrong with you. It is all psychological. You are blind for psychological reasons, not physiological reasons. Blindness is another one. The College Board has cited that example before, where a patient will go blind, truly go blind, go deaf. And the brain seems fine, the eyes seem fine, the ears seem fine, depending on which sense we're talking about. There is no physiological basis for those symptoms, but they are very real. The last one to talk about in this concept map is illness anxiety disorder, which if we took this class 20 years ago, we would call hypochondria. It has a new name now. Illness anxiety disorder occurs when a person believes that normal physical sensations, like their stomach growling or a normal headache, are actually the signs of some very severe disease. And then as a result, produces significant anxiety. It causes the person to call out of work. It causes the person to skip school. It causes the person to constantly seek doctors. It causes the person to seek out MRIs and brain scans to verify their beliefs that the very normal physical sensations they experience are not normal at all and instead signs of a disease. So you might have somebody who has a very normal headache and then chooses to go to the emergency room because they think it's a brain hemorrhage or something. You might have an individual who has a stomach ache who then goes and sees their doctor the next day and says, I know I have Crohn's disease or something. Well, under those conditions, we would likely diagnose that individual with illness anxiety disorder. It is normal to look up your symptoms online. It's abnormal to look up your symptoms online and be confident and definite that the symptoms that you have that, quite frankly, are relatively normal are actually the signs of something distressing, some very significant and severe illness, when that's just simply not the case. And if that mindset of constantly seeking out information, particularly on something like WebMD, that confirms your beliefs that you're actually sick, are not true and are now interfering with your life, that in and of itself is classified as its own disorder.